My name is Takira Cunningham, and today's date is November 22nd, and the time is 9:30 a.m. Today I'm going to be inserting a Foley catheter on my female patient. I'm going to begin by raising the bed up to a working height level, and I'm going to introduce myself. Hi, my name is Takira. I'm going to be your nurse today. I'm going to give 2 patient identifiers, the name and the date of birth. Then I'm going to begin with explaining the procedure to my patient. So I have a doctor's order for inserting a Foley catheter, and this is going to help you get the urine out of your bladder as you're on bed rest. This is going to help you. I'm going to also ask about allergies to latex. Do you have any allergies to latex? No. Do you experience any pain or burning while urinating? No. And when is the last time you emptied your bladder? 2 to 3 hours ago. Great. So now that I have that information, I'm going to provide patient privacy, some hand hygiene, and I'm going to provide some peri-care for my patient. The purpose of peri-care is just for us to be proactive and reduce any types of catheter associated UTIs. I'm going to put on some clean gloves. With my clean gloves, I'm going to get some warm soapy peri wipes to clean my patient. And I'm going to clean in a front to back motion. So now that I have her cleaned, I'm going to take these dirty gloves off. Some hand hygiene, and now I'm going to let that air dry, and I'm going to get my patient in the correct position. Position. Bring the catheter closer to her. Only touching the very outer edge of this drape. Let it down. Now I want to put on my sterile gloves. Alright, now that I have my sterile gloves on, I'm free to touch inside the kit. I got my lubricant. I'm going to open that. It's a little close for her. I'm going to put the tip of the catheter into the lube. That's it. And I'm going to connect the syringe to the catheter. Now that I have that connected, I'm just going to let it sit, and I'm going to let the tip of the catheter stay sitting in the lube, and I'm going to begin my cleaning. So now I'm going to put my non-dominant hand, and I'm going to start by cleaning the labia that's farthest from me. I'm going to throw that away. Clean the labia that's closest to me. Throw that away. And then clean the labia down the middle. And throw that away. So now that I have cleaned everything, I'm just going to toss this right here. And I'm going to get my catheter. And I'm going to begin inserting it slowly, and I'm going to insert 2 to 3 inches. If I see urine return, I'm going to insert 1 more inch. now that I have it inserted, I'm now going to blow up my balloon. And I'm going to use the whole 10 ml to blow the balloon up. Now that I have the balloon blown up, I'm going to just tug on it a little bit. And the purpose of me tugging is just to make sure that the balloon is inflated and it's in the correct spot. So now that I have my catheter inserted, I am going to take the catheter itself and I'm going to tape it, this part, to the inner thigh. Purpose of this is so they won't snug it out or anything. So now that I have the catheter taped, I'm now going to hang it to the bottom of the bed. And I'm going to make sure the catheter is below the level of the bladder. And I'm also going to make sure that there's no kinks or anything wrong with the tubing. So now that I have it inserted, I'm going to clean this area up. I'm going to perform hand hygiene and put on some more clean gloves. All right, and with my warm, soapy perineal pad, I am going to clean her up so like no lubricant or iodine won't be everywhere. So I'm just gonna clean up around. So that way, get my patient back in a comfortable position. Get her back warmed up. I'm going to put the bed back to the lowest level, and I'm going to make sure her call light is within reach. That is how you insert a Foley catheter, and I'm also going to document. And what I'm going to document is my time that I inserted it, any abnormalities such as blood in the urine. I'm going to document the amount of urine and the time I inserted it, and the size of the urine that I inserted in her as well. And that is how you insert a Foley catheter.